rubrics in relation to that Instagram live we took, because rubric understanding and applying the rubrics is really very sometimes become difficult, because sometimes we know everything about the case, we know there is a rubric also, but then we fail to understand why the rubric which we take, the remedies are not working. So every patient has some symptoms which have different shades, and to apply that rubric is very very important. So I hope on Insta Live you got some, because there were a lot of questions in my Instagram in relation to rubrics, in relation to you know uh, how to understand rubrics and how to take the rubrics for prescription. There is not a fixed law every time the same rubrics and same things. It depends on the patient's what how the patient is telling the symptoms. Simple, for example, if it is thermals and you ask the patient, do you bath with hot water, and the patient says, yeah, it depends. Sometimes the patient says, oh, hot water, no, I can't bath with hot water. So the gravity in which the patient is telling you the symptom is very very important. The gravity, and how the patient tells the symptoms and how the associate tells the symptom is very very important. Hence, case taking, if the patient is in front of you, becomes very very important. As I always tell you, good afternoon, Dr. Vishaka, Nitin, Jagjit, real matter. Yeah, father, he cannot urinate freely. No, there is no specific medicine. You can always take a rubric that in old age urinary problems, and there are lot of remedies. I don't prescribe basically only on one symptom, Nitin. So whenever you are asking me a symptom, make sure that you give me some more symptoms to prescribe. Otherwise, old age urination is not a disease, no. So make sure that you basically tell me some more symptoms, and then we can talk on it. But simply speaking, you can always go to the rubrics old age in urine chapter, and you can get the remedies there. How to reduce high homocysteine, even everything else gets better but not homocysteine level. Now this is a good question. First of all, there are some markers for different type of diseases. For example, raised homocysteine level, simple, can be because of vitamin B12 deficiency, or simple because the liver is not working properly, and then it can cause heart problem then as we go further. If you ask me, homocysteine, the main thing to understand is nutrition, because it is related to liver, and most of the cases in raised homocysteine I have always seen there is a problem of nutrition. Now what is nutrition, that you have to understand. First of all, the literal sense of nutrition, the diet is not proper, then diet is not at proper time, the patient is going away from nature, and that's why the body is shouting in different form. One of the form is raised homocysteine level. Second, the nutrition related to mind, that is emotional nutrition. That means what? The patient basically is nutritional deficit of love from mother, father, husband, wife, child, anything. The nutrition he is lacking or she is lacking. Then you definitely ask the patient, where is that nutrition, how is feeling, and then you can enter the case and get the remedy. So these two things are very very important, and I have seen in my practice, in my cases, the homocysteine level can go down with homeopathy medicine. Simple, in 6 weeks, or 6 weeks I normally tell to repeat the homocysteine level. Girl age 26, PCOS patient, regular periods in once in 3 months. She's hot patient, craving for open air, sweets, envy item, social and pimples. She is very angry. OCD patient, sir, please tell. And now see, OCD patient, irregular menses, hot patient. Now, whenever if you are treating a case of PCOS, polycystic ovarian syndrome, now if it is a syndrome, then it is very important to understand what all led what all led to this event. So whenever you call a syndrome, there may be 4 or 5 symptoms, and this symptom does not come suddenly. It comes in a gradual period of time. 1 symptom, 2 symptom, 3 symptom. So ask, in this case, what were the events of life, what are the nature problem in life, what are the things which has deviated the patient against the nature of his of her, that has caused this symptom. For example, I had a very interesting case where the patient had a typical symptom. She was a working lady, and she, whenever she used to go, had to go for urination, she used to suppress the desire, because she always felt, I'll finish this file, I'll finish this work, I'll finish this phone call. She used to suppress that desire to go to stools and urine. And after some time she developed UTI, and that also was taken care of, and the same thing continued. And then she developed PCOS gradually in 2 or 3 years. So we took the rubric natural suppression of natural desire. Are you with me? Suppression of natural desire. And then if you go and see the repertory, there are 3-4 remedies. The remedy which I gave to the patient, I remember I gave the patient Stephysagria 30, I think the next month Stephysagria 200, and gradually in the course of 6 to 8 months I did not repeat Stephysagria, and the patient gradually started becoming better. So this is how you enter a case of this. Now in your case, you say the patient is hot, the patient is irritable, the patient has OCD. You can think of 3 or 4 remedies that come to my mind. First is bryonia, second is sulfur, and sometimes in this case you can think about natrum muro also. Of course, you add further symptoms and then you can get the remedy. I hope it is okay. If it's okay, then please write me so that I know that the answer, the question is completed. Right sole pain full while walking and burning. After continued walking, pain reduces. Please suggest medicines. Patient is alcoholic patient. Yeah, so this is very, very common. This is called as plantar fasciitis, that a patient, or calcaneum spur. The patient is sitting for a long time, especially in the morning when he gets up from the bed. The first step he puts on the floor, there's severe pain. The patient cannot walk. Gradually, when he starts walking, automatically the pain subsides. So there are few remedies which you can think about. First, think about ruta, think about belly spur, think about calcarea floor, think about rustox, think about guaiacum, think about lycopodium, ledampal. I'll tell you one case. The patient told me that whenever he gets up, he finds whenever he sleeps in his mother's room and he gets up, because there is marble there, so the area is very cold and he feels better. But when he sleeps in his room, they have a mattress, so the leg is on the mattress, so in the mattress there is more, and in a mother's room he is better. So if you interpret this symptom, there is a remedy ledampal which is better by cold. So I just prescribed the patient ledampal in LM potency 0102 in this type of potency, and the patient was much better in about 6 weeks time. So whatever the patient is telling you, the symptoms are very, very important. How to interpret what is the patient telling. That's what I was telling you in my Instagram live. In Instagram live, I have started taking rubrics. So if you are following my Instagram live, please understand the rubrics. Otherwise, you can only interpret mind, not that. You can interpret and enter the remedy through the physical symptoms also, my dear friend. That is also very, very important. Okay. I hope you understood. Please suggest some rubrics for mind which correlate the pregnancy condition with infantile disease. Dr. Ajit Singh. Yeah, I basically did not understand the question. What do you mean by, see, in relation to pregnancy, then there are a lot of rubrics. But infantile disease means what? Actually, what you want to, if you can clarify, I can give you the answer. For example, if you see simple rubric like elements from pregnancy, or aversion to friends during pregnancy, or you can say strange desires during pregnancy. I had a very interesting symptom. The patient told, I have a desire to hit my husband. A strange desire. So very strange. Sometimes you can have strange desire in eating also. So for example, a patient who has never touched non-veg, in pregnancy wants to eat non-veg only. So strange desire. Or the patient is very much discouraged in pregnancy, or the patient has fear of death during pregnancy. So in pregnancy there are a lot of rubrics. If you can give me a specific question, I would answer that question. Got from down Navjot. I hope Navjot you are feeling better with the medicine, and congratulations to your brother's wife. She's pregnant, and I hope everything goes very well for the whole 9 months. Very nice. Hello and salams after a long time. Yeah, walaikum salam. Rheumatic fever medicine. These type of questions, put me in dilemma. Now, what to answer? Rheumatic fever, you can think about phosphorus, think about tuberculinum, think about arnica, think about calcarea carb, think about these type of connections are very very because I cannot answer this type of question because I don't prescribe on this type of rubrics and this type of one line. I don't prescribe on specifics. So let us go forward. I hope the internet connection is okay because there's one question on my Skype that you cannot see me properly. So I hope you can see me properly and internet is okay. Dr. Joshi says severe burning of soles of feet, swelling left little finger, slight touch. Uric acid is normal, same color. Think about simple. Start with belladonna. Think of arnica. Think about these type of medicines first. Don't jump on a lot of rare remedies. I always tell to my fellow doctors who are working with me who are sometimes simple medicines can cure cases. Like for example, sore bruised pain. Think about arnica, think about hemamalis, think about naxomica, ruta, rustox, silicia, belladonna. These basically would treat most of the condition. And if it does not get better, you can always then go and think about some other medicines also. Severe knee pain and tears, male diabetic heart. Okay. So now, Jyot, in this case, I would basically think about palliation, ATS case, heart complaints, diabetes, hypertension, not what we can think about more. In these type of complaints, I have got very good results with Formica rufa, Stilingina, Erenia diadana, and sulfur. Dr. Bharat, good afternoon. Ledampal, emulsion, yeah, LM1. Sir, I have ordered Ocanode 3 as the LM dose is not in my clinic. I have other, but this is missing. You can start at least take a dose of Aconite 30 and one pill of number 20 in 100 ml of water, 10 strokes. Take one hourly. At least you can start with that. What questions would you ask for a 70-year-old lady with lichen sclerosis? She has piles too. Important is not that I always tell to my, it's a very good question again. I'll just tell you that one thing is very very important. There is people tell me that, sir, how do you get this, how did you ask and how did you get the remedy, how did the patient tell you this symptom. Now there is no prescribed law which I tell to my fellow doctors. Whenever the patient is sitting in front of me, it depends on how the patient is speaking and depending on what the patient is telling me and what remedy are coming to my mind, what rubrics are coming to my mind, and how can I connect with the patient. The main thing is how well you can connect with the patient. That is important. If you can connect with the patient, anything with the patient connects, and then you can automatically open the case. It's a matter of getting connected with the patient, and you can get best connected when you ask some psoriatic symptom, because those are the beautiful days of life, the psoriatic symptoms. So if you can connect, automatically the patients will start telling you some symptoms. This is how basically I do my case taking. Of course, I have read a lot of books of case taking and all, but I always had that one question: how to connect. With your psoriatic questions, you can connect it very well, and of course, your goodwill in practice, for how long you are practicing, how is the faith of the patient in you. Those are very very important things to understand, because your goodwill, your name, whatever name you're carrying in the market, in the society, that would help you in getting connected with the patient. And the patient knows that this doctor basically asks a lot of mind symptoms, lot of symptoms, so she or he has to be very clear with the doctor, and that's how the patient will start telling you symptoms. So if you ask me what do you ask for the particular disease, very difficult for me. Although some disease I know how to enter the case, but in of this case I may not be able to tell you properly. My bhabhi is much better now, as from bilious vomiting and continues. I have given ipecacuine single dose. Okay. You can also think about Navjot, Symphoricarpus racemosus. That's a very interesting remedy for vomiting of pregnancy. Okay. Yeah, lichen sclerosis, I could say I have very few patients in these cases, and the results are sporadic. Some cases are under my treatment; they are getting good results, and some patients have left me because they did not have the result, because they were already taking a lot of steroids medicine and they did not get relief with my medicine, so they are continuing with the medicines. Okay, I hope that is clear. So I was telling you something about the case taking. So this again becomes a very very interesting part, in the prescription. I hope if there are no questions, I can go forward with what I want to tell you. Otherwise, telling a case would be very easy. For me, karo voice engineer, yeah. There would be some spelling mistake, but it's okay. Now I had a very interesting case. I had a case where I just listened to the case. Just now I have just treated that case and cured that case. I had a very interesting case of pain in the head, and the patient used to tell me the pain is so severe. There's a lot of congestion. Whenever I put my head down, there is pain. When I move my head, there is pain. There was throbbing of the carotids, and whenever he used to lift some heavy work, or he used to concentrate on something, or he study something, he used to start getting headache. You know, headache. And case taking, we gave some medicines. The patient was temporarily better, but he was not getting out of that stage of headache. And when the patient came to me, I was just trying to probe what to ask. I just asked the patient, can you tell me something more? What happens during headache? And the patient told me, sir, last 3 days before, everything was okay, and suddenly, the light went off, so I started getting headache. But I had started getting perspiration also, but I had a headache of left side, and I had perspiration on the right side. Such a typical symptom, and I said, okay, let me find out if there is any symptom in the mathematics and the repertory. So I first went to the rubric perspiration on the scalp, one-sided, and then I put perspiration on the scalp on the painless side. You won't believe there was only one remedy in that, and that is aurum mur natro natrum. If you have the repertory, you can open and see that. Without asking any other symptom, I prescribed the patient in 30 potency. And to my surprise, the patient came to me after 10 days and said, Doctor Saab, no pain this time, and I'm feeling absolutely fresh. I went to the gym also one day to see whether it pains, but it did not pain. So whenever, if you have lot of symptoms, headache, throbbing, and redness of face, aggression by bending down, and congestion, lot of symptoms of lot of remedies. In these type of cases, I have understood ask some symptom which can connect to only one remedy or only one or two remedy, but the rubric or the symptom which you take of the patient should be very very clearly defined. Are you with me? Are you with me? Did you understand this case, and did you understand the remedy? This is a very very interesting case. I also learned something more about aurum muraticum natro natrum. I had never prescribed this remedy for headache till date in my life. 30 years of practice. Would you believe? That is the beauty of homeopathy. You are a student for life. Keep reading, keep asking symptoms. There is no protocol, different protocol for case taking. It depends upon how you connect. If you can connect with the patient, he will absolutely tell you symptom, and you'll be surprised, oh my God, how did not I get this symptom? For patient, that symptom of perspiration was useless because it has no relation with the headache. And so he forgot that. That's why if you can spend time with the patient, if the case is not coming out, I tell it to myself also, because sometimes there are flurry of patients and you want to see patient fast, you forget the symptoms and you prescribe the commonly indicated remedy. Aurum muraticum natricum I have never prescribed. This is the beauty of homeopathy. Are you with me? And do you believe this is the beauty of homeopathy? That is homeopathy. Every time you come to the case, every time the picture of 3 Idiots. Every day you learn something. Every day you learn something more about the so-called porric rest or the rare remedies sometimes. This is the beauty of homeopathy. Do you have standard remedies for glue ear in a young child that you often start with? First of all, if we are prescribing on deafness, or if you are prescribing on only wax in the ear, that is different. Are you with me? So if a case of deafness comes to me, I would definitely go for constitutional prescription, miasmatic prescription with the whole case and why the deafness is there. If you are asking me something in relation to wax in the ear, the patient has recurrent wax. We had a few years back for wax. I used to give mullein oil. Mullein oil drops that was available in the market to put in the ears, and it had a beautiful result on wax. I did not prescribe any medicine and tried mullein oil, and that gave me beautiful results. So if it is wax, you can think about mullein oil, MULLEIN, mullein oil. And if it is a classical case of deafness, then please go for constitution prescribing. Mucus. Okay, mucus on breathing. No, I have basically, if you mucus in the ear. Okay. Now I had a very interesting. I'll just tell you something one, and then I'll go to the remedy. If you have seen my, I think, last YouTube live, or I don't know, before that, I had a very interesting case where the patient came and told me that I have rattling in the throat. There was mucus in the throat, and the patient was complaining of a cough symptom, not better. When I saw the rubric mucus in the throat, I prescribed the patient podophyllum 30, cured the case. So, if you see discharge of mucus from the ear, I have cases where the patient has discharge from mucus in the ear. 3 remedies that comes to my mind which I have used extensively with good results: Pulsatilla, Merxol, and Calcarea carb have given me good results. Sir, my father is also feeling better with a medical heaviness or emptiness feeling in the head gone. Very nice, and nice to know and nice to hear. Whenever, I don't know about you all, but whenever I hear somebody is better or he's better with my treatment, that adrenaline rush starts. This is basically our USP. I love hearing that your patient is better, the sugar is better, the cancer is better, the tumor is better, and it gives us the drive. That gives me the drive to again, go back and study and then give the results. Of course, if the reverse happens, if there is no result, then we feel, oh my God, 30 years of practice and still I cannot get good results. So it gives sometimes a low also. So in practice, every day you come, every day you pass through the stage of low and high. But one thing is sure, keep reading. If you keep reading, the difference between the low and high will be much better. You will have more highs than lows. Okay. I hope that gives you some confidence, because I also have a lot of failures. Let us go forward. Whoever asked the question, the name is not there. So did you understand something about the mucus in the ear? That is also, if you get this, everybody gets different cases in the life, and I always feel that you have to be lucky to get these type of cases. Okay, so let us go forward. If this is taken care of, so did you understand that aurum natricum? So whenever, if a patient comes to you and you have this typical symptom, do think about the remedies, and you have to be lucky to have this type of case in front of you. Now, if the patient complains, there are a lot of patients who come to me that they say that whenever they're eating food, there is a lot of perspiration on the scalp. There was one question on the Skype. So now in this case, sometimes the remedy works, and sometimes it is a basic symptom of a normal symptom of a person. So if a person comes and tells you that after I was suffering from diabetes, blood pressure, thyroid, or pain in abdomen, after that when I eat there is perspiration from the scalp, then do take that for prescription. If the patient had this symptom since long time and don't take that for prescription, it can sometimes work or it can sometimes not work, because perspiration on scalp while eating 3 remedies are very common. That is Calcarea carb, Silicia, and Nux vomica. The mucus not coming out. Okay. So in this case, if the mucus is not coming out and then you can see in this case, if then you have to basically take the concept of Boehning-Osian. You have to take the concept of Boehning-Osian, that there is a mucus because maybe there is a eustachian tube blockage because of upper respiratory infection. Then the remedies would be different. Then you add to that 3 remedies. Those 3 are important. Add to that phytolacca, sulfur, lachesis, and phosphorus. I hope you understood. So add 4 remedies. It may be because of upper respiratory infection. It may be because of blockage in the eustachian tube. It could be because of other reasons. So in that, with that 3-4 remedies, add these 3 remedies: sulfur, lachesis, phosphorus. I hope I am clear. Yeah. Yes. Okay, so I assume that you are that is taken care of. This is the type of cases I get. So I was just telling you what I would have been doing in the type of cases. So let us go forward. Yeah, so let us go forward. Now, for example, now I'll just tell you, if there is no question, I'll take the you understood that perspiration of the scalp, because there were 2 or 3 questions whether to take that symptom for prescription or no prescription. Okay, so I hope you understood what I want to tell you. Sometimes, Hahnemann sir has always told us that take what has deviated from the normal state. If it has deviated from the normal state, then it is very, very important. Otherwise it becomes sometimes a not. Otherwise, you take, it works, very good. You take, if it does not work, then there's a problem. Now, I had a very interesting. Do I take a case? Just a minute. Yeah. A patient 34 is very angry in nature and says, when I'm angry, I listen. No one. Goes on speaking during childhood, seeing many quarrels in very rich family, punching walls, broke glass. Now, if you ask me, there is a rubric in anger. Now, if you open that, if the patient is telling you something, you can take the rubric anger, violent, and you can get the remedies. There's a rubric called as anger throws thing away. So if you say anger throws thing away, or you can say anger stabbed anyone so that he could be. Both are different. Matlab, anger is so much the patient can become destructive. Okay? And the anger is so much that he could kill a person. So when there is anger so much so that he could kill a person, you'll be surprised. It is the remedy. You must think about Hippursulf, Anacardium, and Merxol. Think of Moscus if it is a spoiled child. This is what we tell stab anyone could be. And anger throws thing away. Then you have to think of Staphysagrea, Coffea, Chamomilla, and sometimes I have seen results with tuberculinum. Yeah. Okay, so this is how you have to differentiate the anger. See, if I always tell to my doctors who are working with me, the Soric rubrics: anxiety, anger, sadness, fear. Try to master that from the repertory, because there are different shades, there are different, miasms in those rubrics also. So if you can understand the basic rubric, the basic, symptoms of life, and how that the patient developed in psychosis and syphilis, you can enter the case from there also. Always tell to my doctors who are with me, but they are sometimes lazy. They do sometimes they do, sometimes they don't do also. So I have always tell the importance of understanding these rubrics. So if you can also basically take these Sori rubrics, go to the repertory and see how the patient goes from SORA to psychosis to syphilis, that would be better. Sore throat due to allergy problem, unable to speak. Okay, so we have only few seconds left. Think about Hippursulf, think about causticum, think about nitric acid, think about Merxol, think about phytolacca. These are the basic remedies that should give you results. And of course, if you can get some symptoms more in relation to that, you will be striking the similum on the first day itself only. So thank you so much. It's already half an hour up, and thank you. I hope you enjoyed as much as I enjoy sharing my knowledge with you. Thank you. Bye for until next Saturday for YouTube.